Thank you, Vanessa, and good afternoon. I'm going to begin by talking about the perspective of small business, because small business lives at the seams of market and system failure. It's the law of small numbers. Too small to be a stable risk pool, too small to be the platform for innovation that can lead to lower costs, and even too small for reasonable administrative loads, and too small to be able to price to recoup those costs in products. Many years ago, from 1989 to 91, I chaired the Healthcare Access Commission for the state of Minnesota. And I'll never forget traveling around rural Minnesota where I'm from and seeing small businesses and hearing from their owners about the difficulty in trying to provide coverage, which they really wanted to do, because of the unpredictability year over year as one person in the firm would become sick, or the challenge of doing it without anybody in human resources or who knew how to innovate, so the challenge of looking at how to do that. And then the challenge of having to consider whether it was more responsible to raise prices and pass on those prices to the community or provide health care coverage. Yet, oftentimes 2 doors down, there was a small county or small state of Minnesota office that got to be part of a big risk pool, that had professionals, very savvy professionals, working in the marketplace on their behalf. And I remember that dichotomy and seeing the opportunity for us to do something better for small business. And I'm so appreciative of the work that CED bill that you referenced has done in making that case. Because this doesn't just hurt small business, of course, it hurts all of us. Because small businesses form an emerging, energizing part of our economy. We need new companies, new small companies that become the next new big companies that can provide employment and energy and competitive advantage. New small companies that are the way that help big companies innovate by being purchased and strategic acquisitions by those companies. New companies that provide so much energy. And that requires the brave entrepreneurs who risk failure by setting up these companies and the people who go work for them to have the mobility and the ability to do that without putting everything else at risk. And I don't have a good answer when entrepreneurs come to me and talk about the company that they want to set up, and they've got very good business plans, but they ask me, should they do it and have their family go without health insurance for a few years until they get it going and underway? And I never have a good answer for that. And that is a human problem, and it's an economic problem. Now, you're going to hear in this next period a lot of reasons after the election why healthcare reform can't be tackled now. That the economic problems have simply made it too costly. You'll hear that the polling has changed, that the public puts this way down the list now as the economy's gone up. And you'll hear that it is too difficult to do things that are big, and maybe some smaller pilot projects or incremental acts can be taken. In each case, that's a fundamental misreading of the situation, a misreading of the underlying fundamentals. First, for our economy to succeed, we have to grow. And to grow, we have to be competitive with other companies operating in other countries around the world. We have to be better. And for our companies to bear the kind of load and cost that Lenny laid out, without any additive value in their products or even in the health of their workforce, puts us at a serious competitive disadvantage. And for our companies to be able to innovate and for our new companies to be able to form, our talented people need to be able to move around the economy without jeopardizing the security of their own families. And when the public puts the economy up top on the polls, I would argue they're putting healthcare up top with it. Because what's hard about this economic situation? For so many people, it means not only losing their dreams, their aspirations of what they hope for, but it means losing the essentials. And we see very steep drops in healthcare utilization from people who are uninsured or losing their coverage, and from a lot of people who still have insurance coverage. As much as 20% drops year over year in doctors' office visits in certain cases. So what's so hard about the economy is losing the essentials. And healthcare for people who lose their jobs or who now have such a high degree of deductibles and co-payment that they have just a bit of insurance and don't have the cash on hand to pay out front, that's what the economy is about in big part. And lastly, that it's too difficult. Well, it is powerfully clear that bold acts are less expensive at this point than timid acts. There are some challenges that aren't amenable to pilot projects, and this is one. Now, when I testified at the Senate Finance Committee several years ago, I made the point that this is a situation we can't spend or cut our way out of. We can only get beyond it by greater value for money. And in that situation, it calls for boldness, a real assessment of the fundamentals and taking a series of important steps. We in business know that from our own businesses. I was fortunate to be a part of a small group of people who built United Health Group over 18 years, and when I started, I ran a little department, and when I left, I ran a $32 billion division. And I will tell you, and I'm sure you know this from your own experience, it is the moment when you're bold that you really confront the problems that you have, that you really look at the challenges, and then you organize and act in response to those challenges. Those are the moments that lead to greatness. They are not the moments where you try to patch things up and keep moving or do something small that you can do because it's easier than the things that are hard to do. So I think we as business people have a really important voice to both express the importance to our economy, the importance to us as people, but also the importance and what a difference it makes to be bold. Thank you, Vanessa.